things.
True, sir. True.
So there'll definitely be a surge in the number of
Yeah,
cases.
true.
Welcome to the day 4 of e-workshop series on occupational health and safety in the context of COVID-19 for healthcare professionals, which is organized by Global Development Center, GDC, and Research and Information System, RIS, in collaboration with Public Health Foundation of India, PHFI. If you have any questions regarding the topic of today's webinar, you can put it up in the Q&A section. There's a separate Q&A section where you can put up all of your questions. There will be a Q&A round after this session. If you have any issues regarding the audio and video of the webinar, you can put it up in the chat box, the normal chat box. Our IT support is there to help you with that. Thank you. Now over to Dr. Sadeep. Thank you.
Yeah, very good afternoon, good morning, good evening to all the colleagues, those who have joined today from the different parts of the globe. We have representations from around 18 countries in this webinar series. This is the third webinar series which we are organizing in collaboration with Global Development Center and RIS. And today we are going to have the fourth session of this series, second last session of this series. And before I would hand it over the topic as well as to the respective faculty who is going to lead the session, I just want to give you some updates that if you see the global statistics, we have already crossed 4 million cases, confirmed cases all across the globe now. And if you see the mortality status, more than 2.7 lakhs deaths have already happened all across the globe. If you see the African region, number of cases are around 45,000 now, confirmed cases. And if you see the Southeast Asia, it is already 2,155 cases. In that, India is leading the highest number, that is around 70,700 cases have already been registered in India, confirmed cases, with more than 2,290 mortality. As you see that there are lockdowns going on in our India also. This is the third lockdown position which is going on. And today the Honorable PM, Mr. Modi, is going to address at 8 o'clock regarding the further strategy of the country. So we are all, there is little bit of relaxation in the third lockdown has been given by the central government. In some of the zones, they have divided into red zone, green, orange zone, and the green zone. And accordingly, the activities they have demarcated into these zones. And that's how little bit of relaxations. People are not taking it seriously. But on the other hand, the upsurge of cases have already started. Today, the topic is disaster management and preparedness during the times of COVID-19. We have given the shape of this topic pertaining to COVID-19, but let me tell you, disaster preparedness plans, we should be ready beforehand. Management plans, we should be ready beforehand. Every country has their own disaster management portfolio. In India, we have National Disaster Management Authority, which is the prime body which looks into the disaster management issues. Then we have in the respective states, we have state disaster management response teams are there, those who are looking into the disaster preparedness activities. Recently, last week in India, we have a chemical disaster due to the leakage of a gas in Visakhapatnam, and around 11 to 12 mortalities have already happened. So disasters, this pandemic itself is a disaster, which COVID-19 has happened. It has created a big havoc in the health industry all across the system, all across the globe. The health systems all across the globe has been devastated in a big way. You have seen that it is not only the developing countries, but the developed countries have suffered much more. And you can see the situation of the USA, you can see the situation of the European countries, how the mortalities and number of cases have increased. So these type disasters never undermine any boundaries and anything, but they cross everything, and they do their repercussions are very bad. So keeping that in mind, we thought we should have one session on disaster management and preparedness with special focus on COVID-19. So we have a very eminent faculty with us, and he is Dr. Ragatham Narayana Swamy. He is a physician, occupational health specialist, ergonomist, and industrial hygienist, and He did his MBBS from Rajiv Gandhi University of Health Sciences and MD in Internal Medicine from Johns Hopkins, Associate Fellow of Industrial Health from National Institute of Occupational Health, and he also having a diploma in industrial health. He is currently heading the Occupational Health Pan India for Flipkart Group. Research experience: he has a vast experience in John Hopkins, Baltimore, USA. He was a medical adjudicator for 2 studies, predictors of arrhythmic and cardiovascular risk in end-stage renal diseases and diseases support interventions in renal replacement therapies. He taught occupational health in ICMR, ROHC for 75 medical students. The purpose of saying all this thing is that we have an eminent person today who is a physician also, who is an occupational health specialist also, and who is ergonomist also. I think nothing best than him who can give us and enlighten us about today's topic. Over to Dr. Narayan Swami, sir. Over to you, sir.
Thank you, Dr. Sandeep, for the introduction. Good morning, good afternoon, good evening to all the participants across the globe. Today, I'll be starting my session.
Yes, sir. Perfect. Thank you.
Yes, perfect, sir. Please go ahead, sir.
Today, I'll be talking about the disaster management and the preparedness during the times of COVID-19. Learning objectives. So we'll be speaking today about epidemics and pandemics in the 21st century, the COVID-19 pandemic, disaster management cycle, needs, assessment, and planning, pandemic response stages, pandemic's roles and responsibilities, how Africa is bracing for pandemic impact, New Zealand's elimination strategy, trace, test, treat, which helped South Korea control the virus. Why is it important to treat COVID-19 as a disaster-like situation, though it's a public health emergency? Country-level coordination, planning, and monitoring. What COVID-19 teaches India about disaster management, United Nations Sustainable Development Goals in dealing with disasters, joint efforts to protect the health and safety of all, roles of occupational health safety practitioners, what kind of coordinated effort is required during disasters such as COVID-19 pandemic from a perspective of occupational health professional, protecting workers from the risk of contagion during an outbreak, addressing stress, psychosocial risks, violence, and harassment, managing other occupational safety health risks, which are related to ergonomics due to the heavy personal protective equipment use and chemicals, care which needs to be taken by the workforce. Now, let's talk about epidemics and pandemics in the 21st century. We all know that there are reemergences of certain epidemic diseases like Ebola, cholera, yellow fever, HIV, and newly emerging infectious diseases such as SARS, H1N1, influenza, MERS, COVID-19. And these diseases follow a certain dynamics, like they have an emergence in the community, an outbreak which localize, transmission, outbreak is amplified into epidemic or pandemic, and gradually these reduce in transmission and see the downslide after hitting the peak. And because of today's global integration, travels, urbanization, we have seen an unprecedented high speed of transmission worldwide. The COVID-19 pandemic. In January 2020, there was an outbreak of coronavirus in Wuhan, Hubei province of China. On March 11th, 2020, the World Health Organization declared COVID-19 as a pandemic. Ever since then, it has had an impact on the world of work. There has been increased unemployment and underemployment, worsened occupational safety and health and working conditions, reduced access to social protection, particularly negative effects on specific groups. What is a disaster? A disaster is a result from the combination of hazard, vulnerability, and insufficient capacity or measure to reduce the potential chance of risk. For a disaster, it needs three components, namely hazard, vulnerability, and insufficient capacity. Here, the hazard is COVID-19 virus. The vulnerable group are the population of the world, and insufficient capacity, the world is not equipped adequately to handle this COVID-19 crisis. We have seen drawbacks in various aspects. So now let us discuss about the disaster cycle. As you all know, in the disaster cycle, there is preparedness before the disaster strikes. And after the disaster strikes, there'll be individual disaster response, rehabilitation, reconstruction, and then mitigation. Now let us talk about each and every stages of disaster. The stages of disasters are preparedness. Preparedness is when no novel strain is detected or emerging strain is under initial investigation. The response is further broken down into sub-stages, namely standby. Standby stage is sustained community spread from person to person transmission. Action, sporadic cases or outbreaks occurring in the community, and widespread person to person transmission in community. And the next sub-stage is the stand down, when virus is no longer present as a major public health threat. And the next step is the prevention. So now we will talk about all these stages. When it comes to preparedness, we need to promote respiratory etiquette and hand hygiene practices to the general public, promote infection prevention and control practices with health workers, and maintain high level of infection control for usual respiratory pathogens. Develop, test, revise, and exercise pandemic patterns for the health sectors and across government. Ensure the state medical stockpile is maintained. Support the development and maintenance of health workforce with skills necessary for rapid deployment during a pandemic. Support health agencies to develop operational plans. Engage with primary care providers, especially the general practitioners, the community pharmacy sector, and other stakeholders. Next is optimize hospital performance during peak pandemic activity. The response during the standby stage, we need to sustain community person-to-person transmission of the virus. During this stage, we need to initiate emergency management arrangements as required, check stockpiles, pre-deploy essential items, and plan use of resources and medical stockpile like personal protective equipments, antivirals, and vaccines, and resources to support the administration. We need to enhance surveillance activities that enable early characterization of the disease, commence communications to mobilize health services, emergency responders, and to inform the public about pandemic and other key response strategies. Awareness campaign should be done, and they should reflect the age and cultures of at-risk group, review and consider appropriateness of social distancing measures, ensure laboratory capabilities or capacities, including specimen collection and transport, are ready. Review support arrangements for home isolation and of case at home and quarantine of contacts. We need to prepare primary and secondary care services for anticipated surge in the number of patients. The next stage is the response stage. Here, in the initial action, this initial action detects intelligence about the disease when it is scarce. We don't know much about the disease. During such stages, we need to provide clinical management and public health guidelines to support health system response, contribute to border control measures as appropriate, support the implementation of enhanced surveillance for early characterization of the pandemic virus. For example, the first few 100 surveillance studies should be done. Provide antiviral medication for cases when it comes to treatment, or contacts when it comes to prophylaxis as appropriate. Monitor workforce surge requirements and consider deployment of staff accordingly. Communicate with the public and healthcare workers to inform them of early responses and actions that can help mitigate risks of exposure. Develop targeted messaging and education for sectors directly affected by the pandemic. For example, schools, public transports. Support effective governance arrangements with health agencies and other sectors or networks. Consider implementation of range of social distancing measures. Implement approach health telephony search options. Isolate early cases and contacts in healthcare settings or in the community. We need to implement strategies that support the health of at-risk groups in the community. Prepare or deploy alternative models of care. Focus on laboratory testings, resources on early and accurate diagnosis of cases. In the next response stage, where targeted action takes place, here the widespread activity in the community, response measures should be tailored to specific needs based on available intelligence. Support and maintain quality of care across the health services. We need to implement training protocols for emergency departments and ICUs. Reinforce infection control measures. Provide antiviral medication for cases as appropriate. Support the implementation and management of whole hospital initiative, including alternative modules of care while appropriate and feasible. Focus surveillance activities on collecting core data from routine established systems, including health system performance data. We need to communicate with the public and healthcare workers to help them understand changes in the pandemic response and actions that will help mitigate risk of exposure. Implement strategies that continue to support the health of at-risk group in the community. Monitor and support health workforce surge requirements to maintain healthcare services. And we need to continue to promote infection control measures for healthcare workers and public. We need to prioritize virus diagnostic testing for patients with where results will be affected clinical management. Response stand-down stage. Here, manage the withdrawal of response strategies and transition to inter-pandemic arrangements. We need to consider additional support for maintenance of services in areas disproportionately affected, determine whether to cease enhanced activity and health response measures, continue to ensure that core data is collected from routine surveillance system, including monitoring for second wave of antiviral resistance. We need to ensure communication activities support return to normal business and plan evaluation of pandemic review exercises where relevant. The next stage is the recovery stage. We need to support the return of normal business and recovery active in the community. We need to contribute to the community recovery, ensure surge and support staff recruited to work during the pandemic response are briefed and supported to return to their normal duties across health agencies. Conduct debrief and evaluation activity to inform future plans and policies. Consider preparations for subsequent pandemic wave. In the pandemic roles and responsibilities, a huge number of people have different roles to play. Here, the Public Health Division has to coordinate surveillance and monitoring activity, including early enhanced case finding and contact tracing in the initial stages. They need to develop and implement isolation and quarantine guidelines. They need to implement international border measures, provide guidance and support to laboratories, manage stockpile strategies, develop policies to support operational management, system purchasing, monitoring and reporting on the impact of pandemic on health system performance, coordinating with the LHDs on the management of emergency departments and other pandemic-related services, governance, supporting communication with the private health sectors like private hospitals, providing advice on the supply and administration of pharmaceuticals and supporting links and communications, developing pandemic-related workforce planning strategies and initiatives, including occupational health and safety policies, and liaison with unions and other workforce groups, implementing communication strategies and resources to help healthcare workers inform about the pandemic. Local health districts or specialty health networks. We need to prepare and maintain arrangements for surge staff capacity across all health employment categories, supporting and maintaining quality of care across health services and implementing infection control measures as appropriate, ensuring cleaning and waste management services are appropriate for pandemic, undertaking engagement and seeking arrangement with local government councils on possible support roles during a pandemic, coordinating targeted local communication and support communication of statewide messages. We need to coordinate consistent content of the local health facility pandemic plans. Laboratories. Laboratories play a very vital role during times of pandemic. Here, the communicating with the public and private laboratories across the state regarding pandemic response arrangements, including testing capacity and capability, specimen collection and transport, supplies of reagents and consumables in a timely order should be placed. Supporting public reference laboratories with resource for surge response, ensuring reference centers support provide to other laboratories for acquisition of pandemic-specific testing capacity. And for ambulances, we need to ensure pandemic readiness for all ambulance services, supporting the ambulance controller and close liaison between the public health and medical controller during a pandemic response. So now let's talk about how Africa is bracing for pandemic's impact. Africa's number of COVID-19 cases are rising, and along with it, the fear. Currently, the African population is close to 1.2 billion, and there are 54 countries in Africa. The worst hit country in Africa so far has been South Africa, with around close to 11,000 cases. But the continent has vast knowledge in dealing with infectious diseases that could help stem the spread of COVID-19. The global COVID-19 crisis is paralyzing the major cities of African countries. Despite the early success, the World Health Organization warned Africa could be more affected by COVID-19 than other regions of the world. But Africa is not a defenseless victim of pandemic. Keeping distance and infection control are not new concepts for African population due to long-standing fight against lung diseases like tuberculosis. Even existing educational materials such as tuberculosis and HIV can be used in the fight of COVID-19 with slight modification. In contrast to some industrialized countries, African countries have opted for scientifically sound solutions. Recently, in 2014, the fight against Ebola and other infectious diseases have shown that it is not always the question of receiving a lot of international aids and huge sums of money. So far, it has appeared in the first phase, the coronavirus crisis have been locally prevented by the local communities, civil society organization, and village chiefs. Another advantage of the virus is that it reached Africa at a much later stage. And we need to even keep in mind the disadvantages of Africa, where the water crisis are present and even poverty is there. Right now, 39 out of 47 countries in Afro-Wu region can now test and confirm COVID-19. Now let's talk about the New Zealand's elimination strategy. The country recorded first ever case reportedly on February 28th. The New Zealand's fights against COVID-19 started with a major decision to close borders on May 19th. They banned all the inbound travel to the country. Only returning citizens and some essential workers were allowed in. On March 23rd, the country entered Alert Level 3, closing non-essential business, cancelling all gatherings, and banning domestic travel. 48 hours later, the country progressed in Level 4 lockdown, which is dubbed as Eliminate Policy. On 27th April, the country declared that it had eliminated coronavirus because they didn't have any new cases. The country returned to level 3 of the lockdown and eased some of its restrictions. People are now allowed to expand their social bubble and interact with more people while adhering to social distancing measures. Testing capacity. The country, with a population of approximately 5 million people, managed to keep the number of infections to low as 1,489 cases with 21 deaths. New Zealand has reportedly administered more than 100,000 corona tests at the rate of 2,190 tests per 100,000 population. So what after the level 3? The country will conduct a review of the situation on May 11th and will remain in the level 3 till then. As of today, there are 90 positive active cases and 21 deaths in New Zealand. How well can the elimination strategy work for other countries? The country has certainly emerged as a role model for other countries. Global experts have appreciated New Zealand for winning its fight against pandemic because of the elimination policy that they have adopted. However, many experts reports have also claimed that New Zealand's strategy cannot work for other countries because New Zealand has an advantage of low population and isolated geographical location. And there are very few travelers from China and other countries. Another argument suggests that cost of implementation of similar strategy is quite high. Now, let's move on to South Korea. The trace, test, and treat strategy of South Korea controlled the virus. What is the latest situation with the coronavirus pandemic in South Korea? South Korea is now in full control of the spread of the disease. They had a peak of 989 cases in February and double-digit figures in mid-March. Currently, there are only single-digit numbers of cases which are being reported. South Korea might be the only country that hasn't imposed a lockdown within its territories or even of its international borders. Their own strict measures to prove and prevent inflow and outflow of the virus. How has this been possible? Korean model is grounded on concentrated testing of high-risk areas and clusters. Korea found out in the beginning that the spread of virus, that a certain religious cult group and its gathering were the cause of large portion of spread in certain areas of the country. The group had massive gatherings in closed-off space. So what they did was like they tracked everybody down and they ran all the tests on them and they confirmed the number of cases in them. However, South Korea succeeded in identifying and isolating potential cases at a very early stage and finally flattened the curve. How are India and Korea cooperating and sharing information during this crisis? Has India made specific requests for testing kits or medical equipment so far? Korean government has repeatedly communicated with the Indian government on what is going on in Korea and how they are tackling the virus. Already 9 Korean companies have received export license of testing kits. Why is it important to treat COVID-19 as a disaster-like situation, though it's a public health emergency? India is facing one of the biggest public health, social, and economic crises it has seen in generation. The government needs to recognize that this is completely unprecedented, nothing less than a war, and that while they have taken some steps to combat this, the sheer magnitude of the problem means that these alone won't be enough. If India wants to create a meaningful response to the crisis, we need to pull in and mobilize all the resources we have in the country. This needs to start at the top with the government and percolate down to every public, private, and civil society actor. India has declared COVID-19 outbreak as a notifiable disaster under the Disaster Management Act of 2005. The difference this time is that the government is treating this as a lockdown first. The administration has forgotten that this is a disaster, and like in any other disaster, the focus should be on bringing the resources to fight this and not just ensuring that nobody steps out. Though the current lockdown is necessary by itself, it is not enough to flatten the COVID-19 curve in India. So what needs to be done? A working framework. The government needs to create a framework where civil society organizations are able to aid and support the work the government is doing. 3 key elements of this framework include a broader directive from the union government, ideally the Prime Minister's office, granting permission to organizations so that they can start working and support the response on the ground, a set of guidelines outlining specific ways in which civil society can contribute and strengthen the government response, a dedicated point of contact with the government, This can be separate body at the national level, such as National Disaster Management Authority, or at the state level, such as Chief Minister's Office, whichever is more appropriate. Civil society has a bigger role to play over here. The government officers at the state and district level know that the civil society is a critical partner when it comes to relief work, and that it's only the biggest resource available to them. When deployed effectively, we can reach places where others cannot, and we can do it quickly and efficiently. If given a framework to operate within, we can draw our experiences and extensive reach to mobilize and channelize resources. We can leverage on strong relationship with communities and ready pool of volunteers and resources. Provide immediate relief. Just like in any other disaster, civil society can serve as first responders for providing food, ensuring water and sanitization facilities in camps, and even distributing protective gear, particularly in far-flung areas. Run awareness campaigns. Given the amount of misinformation going around, we have a major role to play in building awareness during communities, among communities, panchayats, and public representatives. This is how the people are treating their fellow villagers. When a person walks for more than 200 to 300 kilometers to come home, instead of ostracizing their own people, communities need to be trained on how to identify symptoms that require isolation and how to quarantine and how to do physical distancing and among other things. Address the issues of livelihood. Once the immediate relief needs are met, ongoing activity will be to revive the economy, particularly at the rural and informal sector level. According to the Disaster Management Act of 2005, a disaster management is defined as a continuous and integrated process of planning, organizing, coordinating, and implementing measures which are necessary or expedient for the following: prevention of danger of threat of any disaster, mitigation or reduction of risk at of any disaster, capacity building, preparedness to deal with any disaster, prompt response to any threatening disaster situation or disaster, assessing the severity or magnitude of effects of any disaster, evacuation, rescue and relief, and finally, rehabilitation and construction. What is a lockdown? A lockdown is an emergency protocol that prevents people from leaving a given area. A full lockdown will mean that you stay in a particular place and do not move out. This scenario usually allows for essential supplies. All non-essential activities are cut off. What does the coronavirus lockdown mean for Indian citizens? We are making efforts that there is no difficulty in daily life. We are taking all steps to ensure continuous essential supply. Under the coronavirus lockdown, essential supplies in grocery stores, pharmacies and banks are open, and even the hospitals will be open. Are we ready for this? We are currently dealing with significant global and national challenge due to ongoing COVID-19 crisis and the consequent lockdown measures mandated by central and state government. It is indeed a crisis that we are going through as a nation. The magnitude of the crisis has been big, and there is no laid out strategy to follow in these difficult times. As a nation, it is equally our responsibility to ensure that we safeguard our people continuously, in alignment with the guidelines and advisories released by state and the central governments. What COVID-19 teaches India about disaster management? Ever since the Prime Minister has announced 21-day lockdown on 22nd March to contain the spread of COVID-19, we have been facing a number of issues like migrant workflows, which has been stranded, connectivity issue because of the closure of the flights, buses, and trains, hunger and hardship, because we are having migrant workers who have actually come to different states of India, and they are basically workers who are dependent on daily wages. So they have a lot of hunger and hardships which are going through. Health infrastructure, whereas the doctors and health experts have expressed concerns about the capabilities of the healthcare system in India due to the shortage of personal protective equipments, medical equipments, and ventilators, and intensive care unit beds. So what needs to be done? What are the actions which need to be implemented in order to contain this pandemic? Number one, spread, speed and accuracy are the keys to identification and detection. One of the critical tools in controlling a major epidemic is having specific, reliable, accurate, and fast detection method for screening infected and non-infected people. Initially, when there was COVID-19 infection in India, we were lacking in number of testing facilities and even in the kits, but we have significantly increased the number of tests which we run every day, because we even now have our own indigenous kits. Make the right decision at the right time, the right place for the right people. Provide clear guidance about the degree and scope of lockdown. Track implementation due to individual apartments, houses, communities, organization, public facilities, and city management. Keep essentials like food and supplies flowing through organized government-controlled arrangements. Designate infectious disease care and management facilities to isolate, monitor, and treat positive cases. Establish electronic recording and tracking system and local response team to handle infected cases 24/7. Establish centralized reporting and communication channel to keep every citizen informed. Big data and information technology are important. Policies implemented post 3rd May. The businesses are reopening based on priorities. For example, the healthcare related facilities were allowed to open first. Along with it, certain pharmaceutical companies, because there was a shortage of drugs, and gradually the e-commerce activities have been resumed to provide some non-essential items and essential items. Restrictions were eased based on track records. Basically, we marked and demarcated each zone as green, yellow, and red zone. In the green zone, it allows for the free movement. In the yellow zone, it requires certain restriction. In the red zone, there is complete lockdown. The yellow and red zones can be turned green after the cases decrease or patients get better. This health surveillance system has been in most of the cities. Evaluate medical resources and response system. Are we ready for the pandemic? How much stock do we need? Do we have enough healthcare personnel? And how do we protect them? The shortage of protective medical supplies and lack of knowledge about COVID-19 were the main factors causing the large number of healthcare workers to contract the virus in early weeks of the outbreak. At the same time, however, we also need to consider other types of patients suffering from major non-infections like cancer, hypertension, and diabetes. Implementation of preventive measures in communities, schools, business, government offices, and homes can influence the trajectory of this pandemic. In this fight of COVID-19, everyone is equal. Everyone has the same responsibility and shares the same risk. COVID-19 is a very contagious and capable of asymptomatic spread. So it's even more important to mobilize all of the society and get everyone involved in the process. We also need to change how we have been living and be responsive to new challenges. Careful planning and clear guidance will help. During an epidemic, it is advisable to avoid large gatherings and multiple person-to-person contacts. We need to keep the public well informed. The major news outlets provide daily updates on the number of COVID-19 cases. The Indian Council of Medical Research has been fully engaged since the beginning of the outbreak. We developed an easy-to-understand educational material for students and the public with the information about COVID-19 and how to prevent the spread. We speak on televisions and even have write-ups on the papers. We believe it's responsibility of all public health experts to provide factual and scientific information to people and to lend the way in the fight of the disease. Now let's talk about the United Nations Sustainable Development Goals in dealing with disasters. There are 17 goals. No poverty, zero hunger, good health and well-being, quality education, gender equality, clean water and sanitation, affordable and clean energy, decent work and economic growth, industry innovation and infrastructure, reduce inequalities, sustainable cities and communities, responsible consumption and production, climate change, life below water, life on land, peace, justice, and strong institutions, partnerships for goals. Sustainable Development Goals. What do they mean for disaster risk reduction? The United Nations 20-year review shows that earthquakes and tsunamis kill more people, while climate change is driving up economic losses from disaster. Disaster risk reduction cuts across different aspects and sectors of development. There are 25 targets related to disaster risk reduction and 10 of the 17 Sustainable Development Goals, firmly establishing the role of disaster risk reduction as a core development strategy. The United Nations Sendai Framework for Disaster Risk Reduction. The properties for action. There is a need to focus action within and across sectors by state, local, national, regional, and global level in the following 4 priority areas. Priority 1, understanding disaster risk. Priority 2, strengthening disaster risk governance to manage disaster risks. Priority 3, investigate and disaster risk reduction for resilience. Priority 4, enhance disaster preparedness for effective response and to build back better. The scope. The present framework will apply to the risk of small scale, large scale, frequent and infrequent, sudden, slow onset disasters. The expected outcome, the substantial reduction of disaster risks and losses in lives and livelihoods. Goals, prevent new and reduce existing disaster risks through the implementation of integrated and inclusive economy, structural, legal, social, and vulnerability for disease. Increase preparedness for response and recovery, thus strengthening the resilience of the people. Now let's talk about the joint efforts to protect safety and health of all. The key pillars in responding to the COVID-19 crisis are stimulating the economy and employment through active facial policy, supporting enterprises, jobs, and incomes by extending social protection for all, protecting workers in the workplace by strengthening occupational safety health measures, adopting work arrangements, rely on social dialogue for solutions by strengthening the capacity and resilience of employers and workers' organizations, strengthening the capacity of governments, integrated occupational safety health into crisis of response. We need to promote safe and decent working conditions, including provision of personal protective equipment and medical assistance for all workers. We need to review, establish, and re-establish or reinforce labor legislation if necessary, including provision on labor protection and safety and health work. Social dialogue on occupational safety health in times of pandemic. When it comes to employers and their organization, they need to collaborate with the government to shape the policy measures that are conducive for business resilience and sustainability. They need to observe, advise, guidance provided by the public authorities, communicate critical information to workers, review and draw up a business continuity plan, identify and mitigate risks of contagion to the workers, and promote workplace hygiene. Workers and their organization, what do? They need to participate in decision-making and policy response to pandemic, actively cooperate with employers in implementation of the preventive and protective measures, strictly follow the workplace hygiene practices, and adopt a responsible behavior. When it comes to informal workers, they may need work despite restrictions on movement and social interaction, may not be able to comply with the occupational safety health measures and its precaution. They lack sufficient protection like social protection, sick leaves, and unemployment benefits. Now let us talk about a particular role for occupational safety health practitioners. They need to facilitate access to reliable information. They need to promote understanding of the disease and its symptoms, support in the risk assessment, and management process, help in development or update of plans for the prevention, containment, and mitigation and recovery. What kind of coordinated effort is required during a disaster such as COVID-19 pandemic from a perspective of occupational health professional? The objectives over here are: we need to ensure health and safety of all our employees, facilitate to set uniform acceptable standards across the group. Why do we have to focus on safety and health at work? Identification of workers, occupations, sectors which are at increased risk of the contagion. Implementation of control and preventive measures based on risk assessment. Dissemination of information on preventive and protective measures to reduce the spread of infectious diseases. Employers' roles and responsibilities. We need to ensure that the workplaces, machinery, equipment, and process under the control are safe and without any risk to the health. We need to ensure that the chemicals, physical, and biological substances and agents under their control are without risk to health when the appropriate measure of protection are taken. We need to provide, where necessary, adequate protective clothing and protective equipment. We need to ensure the workers and their representatives are consulted, informed, and trained on occupational safety health. What are the workers' rights and responsibilities? They have the right to remove themselves from a work situation which they have reasonable justification to believe presents an imminent and serious danger to their lives or health without undue consequences. They have the right to receive adequate information and training on occupational safety and health. They have a right to inquire into all aspects of occupational safety health associated with their work. They have duty to cooperate with the employer in the field of occupational safety and health. Protecting workers from risk of contagion during an outbreak. So here, the occupational health physician plays a major role in the assessment of the risk of the contagion at the work. The probability to be exposed by the risk of contagion, taking into account the characteristics of infectious diseases and the possibility that the workers may encounter infectious persons or may be exposed to contaminated environments or materials in this course of their duties. Severity of the resulting health outcomes, taking into account individual affecting factors like age, underlying diseases, and health conditions, as well as measures available to control the impact of the infection. So here, the emergency response workers in the hospitals and hospital-related industries like healthcare workers, laboratory personnel, death care workers who usually deal with the dead bodies, emergency transport workers, cleaners and waste management workers in healthcare and emergency facilities, and others who are known as the frontline workers like police officers, civil protection personnel, military personnel, firefighters. They are all known as the emergency response workers. So they have a risk of contagion because they come in contact with infectious patients and co-workers. They contact with infectious blood, tissue, and bodily fluids. They have a contact with bodies of persons who have died from highly infectious disease. They have a contact with contaminated materials and surfaces and environments. Medical equipments and personal equipment are not properly used and cleaned or disinfected when they use. So here are the examples or measures to prevent the contagion in emergency response workers. Environmental and engineering controls. Here, they aim at reducing the spread of pathogens and the containment of surfaces and objects. Physical distance between patient and healthcare, emergency worker, ventilated isolation room, etc. Administrative control. These are aimed to prevent risky behavior, such as infection prevention procedures, occupational safety health training, health monitoring, and surveillance. Appropriate PPEs and training on how to put them on, remove, and dispose should be done for these emergency response workers from time to time. Workers in essential activities who are at risk. Workers who interact with potentially infectious individuals like workers in shops, supermarkets, banks, etc. Workers in high density work due to proximity with other workers in semi-confined settings such as factories, call centers, open space offices. Here, the examples of measures to prevent the contagion or the risks are physical distance, that is to introduce work shifts using phone calls and virtual meetings, hygiene, provide hand disinfection, promoting good respiratory hygiene at the workplace, and cleaning regularly, and disinfecting the surface of the desk, workstations, and working objects regularly. Training and communication. Training and communication are essential for these people to remove themselves from work situations that pose imminent and serious dangers for life and health. Response. Arranging for isolation of any person who develops symptoms at the work site. Personal protective equipment. Addressing stress, psychosocial risks, and violence and harassment. Stress and psychosocial factors during a pandemic. These have a greater role to play during the pandemic because the response to such psychosocial factors are increased stress, low mood, low motivation, anxiety and depression, serious effects on mental health. So the common psychological factors are fear for one's own health and well-being of the family and co-workers, lack of safety equipment for personal protection. There is isolation, lack of social support, and tension between established safety protocol and the desire to take care for or support individual. There is job uncertainty. A large number of workers and entrepreneurs and self-employed persons are out of work. There is temporary closure of business and there is change in work process and arrangements. These present increased stress, anxiety, and burnout, reduced motivation, low compliance with safety efforts. Workers in emergency response and in essential services, even they suffer from psychosocial factors. For example, they are the fear of being infected, lack of access to personal protective equipment, working in an environment with low capacity to apply optimal occupational safety health measures, increased workload because they have to sometimes work double shifts, and when there is reduction in the staff, reduced rest period, increased violence and harassment, both physical and psychosocial at workplace, increased social stigma and discrimination because there is a perceived link with a disease. Here, increased fatigue and stress negatively impact mental health and well-being, increases the risk of work-related injuries and accidents in such healthcare professionals. Workers in emergency and essential services. Examples of occupational safety health measures to prevent and reduce stress. Good communication and up-to-date information, multidisciplinary session to identify concern and to work together on strategies to solve problems, checklists to assess personal strengths and limitations, buddy system to provide psychosocial support and monitor stress and burnout, regulated rest periods for taking sufficient rest breaks during the workday. Opportunities to promote physical health like exercises, healthy eating habits, psychosocial support for workers to share fears and worries confidentially. Role modeling. Managers and supervisors must conduct themselves in a way to show how to manage the stress. Campaigns to reduce stigma, participatory techniques which can promote dialogue, innovation, solutions, and positive changes in attitude. People working from home. The common psychosocial factors are inadequate information, isolation, long working hours, blurring lines between work and family life, multiple burdens like working duties, household chores, caretakers, homeschooling, frustration and boredom, and domestic violence, along with the spouses. People working from home. The examples of occupational safety health measures to prevent and reduce stress in them are management, commitment and support and connection with supervisors and colleagues, clear expectations, like results to achieve and tasks to be done, flexibility, disconnection from the work at specified times, reserved for rest and personal life, appropriate equipment like laptops, apps for teleworking, and adequate IT support. Training should be given to them. Good system of communication and support service, including employee assistance programs. How do we manage other occupational safety health risks, like ergonomics? How do we reduce the repetitive stress injuries which are caused because of poor postures while working at home? Because there is going to be associated with longer working time and higher workload and higher pressure when you're at home, because you'll be dealing with other factors. Here, because of all these things, we have increased musculoskeletal injuries, diminished work capacities, reduced ability to adhere and to stick to work practices, increased absenteeism, higher risk of workplace accidents are common. So occupational safety health risks that are associated with the use of heavy PPE among healthcare workers are: healthcare workers are subjected to heat stress and dehydration because they need to wear all the protective gear along with the goggles, the PPEs, the masks, and even the face shield. There is going to be dizziness because they'll be working and they'll be forced to do double shift sometimes, and the working hours do not have any time limit. They sometimes have to forego food and water for 6 to 8 hours, and there will be physical markings on their faces because of goggles and the masks. They'll be actually coming in contact with the chemicals, because cleaning and disinfection with the chemicals becomes key element to prevent contagion in all workplace. Quaternary ammonium and sodium hypochlorite are frequently used. They increase the risk of COPD, reduce fertility, affect asthma symptoms. All workers must be properly trained on the correct and safe use of chemicals and briefed on their risk and exposure level. People working from home. Home settings often do not meet the same occupational safety health standards as those available at the office work sites in relation to both facilities and equipments, physical environments such as heat, cold, lighting, electrical safety, home hygiene, and other things. Workers should receive adequate information on reviewing where the screen should be located, how best to place the equipment to minimize twisting or overreaching, varying work tasks to change positions, regularly taking breaks, and moving around after working for prolonged intervals of time. So now, let us actually check out how do we protect COVID-19 in the industrial setup. These slides were made for the information of our industry to educate the population over there and to educate our workforces. So I'll be just running a few pictorial representative slides so that you can get how to protect COVID, close contacts, person-to-person spread, social distancing, health monitoring, temperature screening, commonly touched surfaces should be disinfected, hands which keep touching eyes, mouth, nose frequently, cleaning hands with soap and water or rubbing hand sanitizers, cough, sneezing and talking, cough etiquettes and use of masks, social distancing of 6 feet. Strategies for COVID-19. We need to facilitate these through COVID-19 task force. There should be social distancing, working with less manpower, markings at all crowded gathering places to facilitate social distancing, screening and monitoring with non-contact body type temperature scanning, that is using an infrared scanner, continuous monitoring of people's health and safety declaration process through an online app, monitoring of people's location through again an online app, disinfection and sanitization, regular sanitization or disinfection of all common large areas, touch-prone areas, disinfection tunnels and entry, extensive use of hand wash with soap and alcohol sanitizers, containment plan, self-declaration through app, thermal screening while boarding bus, isolation of sick people at entry gates, quarantine rooms for suspected cases, prevention and awareness, masks for all people, personal protective for staff dealing with multiple people, awareness through trainings, videos, posters, hoardings, and from occupational health center teams. Social distancing. Social distancing, even at the assembly point, should be 6 feet. For people working in offices, they should work with lesser strength and the people should be divided in shifts. There should be staggered shifts and start and end timings. Production people to be called as per government guidelines. There should be no overlap between shifts, providing cushion of almost 1 hour for disinfection. There should be a social distancing markings everywhere in the company to ensure that people maintain 6 feet at entry gates, bus bay, water coolers, cafeterias, tea points, and other places. Guidelines. Detailed social distancing guidelines laid out for all activities carried out from commuting to and working in the office. Screening and monitoring. So the thermal screening should take place by infrared temperature detection, and there should be self-declaration and digital residence location tracking and use of Arogya Setu app. This Arogya Setu app is a government app which has been launched by the government of India. In this app, we can track the number of positive cases in your surrounding locality. Disinfection and sanitization. The common areas should be always disinfected and sanitized. Disinfectant tunnel. Every entrant must pass through tunnel spraying disinfection which is under evaluation. So the Ministry of Family Health and Welfare has recommended spraying of disinfectant on individuals or group. So recently there was a study by NCL and ITC, the National Chemical Laboratory and Institute of Chemical Technology. They have said that using 0.02 to 0.05% of sodium hypochlorite is safe. And they say 0.02% for normal office spaces and 0.05% for frontline workers are safe. And they have already submitted the report to the Government of India, and which is under investigation. And they will be allowing this once the COVID-19 cases increase further. High touch areas like frequent disinfection and sanitization of all touch points. Sanitizers for all people should be placed at strategic locations. So disinfection and sanitization. Here I'll just briefly tell you about the potential contact areas, appropriate disinfectant applications, recommended application, and disinfectant frequency. For hands, we know we are supposed to use soap and water for 20 seconds. For high-touch surfaces like table, doorknob, light switches, countertops, handles, should be done using linen or adsorbable cloth. Here we need to use 1% sodium hypochlorite once in 4 hours or more frequently if cough or sneezing is observed. In indoor areas like entrance gates, lobbies, canteens, we need to mop or spray 1% sodium hypochlorite once in 4 hours or more frequently as possible. So, like carpeted floors, rugs, drapes, curtains, surface cleaning agent should be used, soap and water once in 8 hours. Electronics like keyboards and screens and controls, wipe using linen or absorbable cloth, 70% alcohol or benzylcholium chloride, once in 4 hours. Laundry, clothing, towel, linen, surface cleaning as manufacturer recommendation, once in 8 hours. Quarantine areas like bed frame and tables should be mopped and wiped with 1% sodium hypochlorite, once in 2 hours, or more frequently if cough and sneeze observed. Toilet or hand wash area. Toilet pots, commodes, etc. should be surface cleaned or deep cleaning with scrubbing of 1% sodium hypochlorite or soap powder or detergent once in 2 hours. Vehicles, tires and high-touch surface areas should be power washed or sprayed with 1% sodium hypochlorite solution, minimum of once in a day. Containment plan. The occupational health center at each plant should have a quarantine room. There should be a separate quarantine room at all working men's hostel and women's hostel and quarantine facility in labor sheds. Prevention and control. Masks for all people, PPE for all people, awareness and education, which should be driven by COVID-19 task force through mailers, posters, hoardings, video communication, train the trainers, digital sessions. This training should be by in-house occupational health center team. People movement framework. Now let us discuss how do people move from home to office, and in the office, how do they enter and exit for working. So I will be broadly discussing about all these points in the following slides. When at home, before leaving, monitor health, wear a mask, always carry small sanitizer bottle and handkerchief. After reaching, ask the door to be kept open. Don't touch your door or door handle. Inform your family in advance to leave the door open. Sanitize before entering. Leave your shoes outside. Wash your hands and sanitize your belongings. Take a bath and put your clothes for washing. Take good hot water bath. Put your clothes for washing. Transportation. When we are using the company transport, we are not allowed to crowd like before. We need to maintain distance while boarding and deboarding. And it is advisable to use self-transport. If using two-wheeler, wear proper gear, including helmet and gloves. For refueling, use e-payment or give exact amount of change. Avoid carpooling if no option, then not more than 2 people. Public transport should be as much as possible. There should be mandatory use of masks. Avoid touching anything. Don't share shared autos and cabs. Practice social distancing. Immediately use the sanitizer once your journey is complete. Entry into the company. In case temperature is above 100.4 degree Fahrenheit, stay back or wait for the OHC people or the admin to escort you and follow their directives accordingly. When you are coming to a company through a two-wheeler, personal transport company, you need to queue up and stand on the markings. Temperature screening will be done over there, and after that, e-self-declaration will be checked. Use hand sanitizer. Gate card punch. Avoid ID card with readers. Contact of ID card with readers. The biometrics should be disabled. Disinfectant tunnel, good to go to work. 4-layer temperature screening. Temperature check should be done at home. We need to check for any COVID symptoms. Self-declaration through an app. Social distancing at bus stop. Temperature check before boarding the bus. Board from last row, exit from the first row. Maintain social distance while moving from bus bay to entry. E-pass verification by security. The 3rd layer check of temperature occurs at the entry and enter the plant through disinfectant tunnel. Temperature check before exit from the premises. That is after the work, the 4th layer check will take place. Movement within the facility. Walkways. Do not walk in groups. Security, safety, and volunteers to point out if there is overcrowding. Attendance punching. Follow markings while in queue. Biometric access should be disabled. Office working. Follow new seating plans and use digital medium or phones for interaction. Shop floor working. Adequate partitions. Change in layouts to maintain social distancing. 100% adherence to safety norms. Tea breaks. During tea breaks, employees should not queue up. There should be increase of number of tea points and staggered tea breaks. Using washrooms. Follow social distancing norms while using the washroom. and avoid spitting in the washroom. Utilization of cafeterias. There should be staggered meal times. Sanitization and social distancing must be kept in mind. The guidelines while eating in the cafeterias are wash hands, stand on markings, let the staff serve, sit as per new guidelines, enjoy your food with the spoon. Do not use hands. Things to keep in mind while at office. Meeting room usage. Avoid physical meeting. If avoidable, attendance to follow social distancing norms. Meeting rooms can be converted to workstations. Working area rules. No handshakes. Greet with namaste. Define your chairs. Do not use anyone's chair. Don't share food or snacks on the desks. Keep sanitization, washing your hands every few hours. Sanitize your laptops, mobiles, desks twice daily. And what all remains closed or discontinued are foreign or domestic travel, creche, engagement activities, large gatherings and trainings, gym and sports. Things to keep in mind while at plant. Employees should wear PPEs always. They should maintain 6 feet distance. Employees should sanitize their hands provided at various places around the factory. Employees should avoid physical greeting. Disinfect the machinery after every shift. Operators to clean machinery before leaving the workplace. Where possible, install partitions around machinery to ensure social distancing. Zone-wise and station-wise PPE matrix to be displayed. Material handling at plant. When the material arrives via truck or goods carrier, the vehicle is disinfected before entering the facility. After the material is loaded, it is disinfected again and this is placed in the disinfect or quarantine spot for 24 hours. Then the material is moved inside the stores. Things to keep in mind while returning home. Sanitize your vehicle, sanitize yourself and the contact points of the vehicles. Shop from a dedicated shop only. When you're shopping for grocery and daily needs, you should shop from a dedicated shop always. Carry your bags while shopping. Avoid taking plastic packs from outside. Try to make payments. Avoid transaction of currency. Avoid going to public spaces. Do not visit malls, movie theaters, and restaurants. Avoid gatherings. When outside. When eating in common places, maintain social distancing while queuing and seating. Wash and sanitize your hands before and after eating. Avoid talking during meals because the spit droplets can go to the opposite person. Don't spit out food on tables. Use tissues and dump the tissue in closed-lid dustbin. Avoid sharing utensils. Regular cleansing and disinfection at home. Kitchenware should be placed in boiling or high temperature water for 15 minutes. Frequent contact areas like doors, handles, tables, chairs should be cleaned with disinfectants. Mobile or tablets or laptops should be used with wipes to clean surfaces frequently. Care for your loved ones. How do you take care of your elderly at home? We need to spend time with them. We need to get them involved in recreational and daily activities. Cut down on listening to fake news. Make some time for exercise. Elderly with chronic conditions should monitor and consume medicines daily. Taking care if you have kids at home. Disinfect or sanitize toys frequently. Do not blow on baby's foot. Wash your hands once you arrive home before carrying kids. Teach and reinforce everyday preventive actions to the kids. Avoid bringing kids out and help them stay active. Do not share utensils with the kids. Precautions for self. Let's all do our part. Avoid close contact with people who are sick. Cover our cough, sneeze with keep our homes and surroundings clean and well ventilated. Monitor our temperatures twice daily. Avoid touching the faces with hands. These are the washing techniques. We need to ensure that we wash our hands for 20 seconds. And even when we use sanitizers, we need to ensure we rub it all across for 20 seconds. Advisory on masks. Before putting on masks, clean hands with sanitized or wash them with soap. Cover mouth and nose with masks and make sure there are no gaps between your face and the mask. Replace the masks as soon as it is damp. Avoid touching the mask while using it. Do not reuse a single-use mask. To remove the mask, remove it from behind. So this is the symptomatic person's handling. So when we have a suspected person, he is known as the person under investigation. When the results are positive, follow the guidelines as per government norms. If he is negative, hospitalized and report to work with fitness certificate. When we are having a confirmed contact person, we need to isolate them immediately and take regular health updates. If they have COVID positive symptoms, inform the superior, go to the hospital and follow the government guidelines. If no, stay at home for 14 days and monitor symptoms. Submit fitness certificate before entering the office or the company. Probable close contact person. We need to check health risk, portable contact, confirmed contact. We need to isolate employees and advise work from home for 14 days. Here, the HR and the occupational health center people play an important role in screening and finding out who are all the contacted persons by them. Forms and formats. So these are the forms and formats which are used in the offices or the company. They are self-examination by staff to prevent the spread of COVID-19, for security staff to prevent the spread of COVID-19, self-declaration form for the visitor, and communication posters. So along with all these precautions, we can ensure that we contain the spread of COVID-19 and gradually win this war against COVID-19 and turn out to be a better world to eliminate this COVID-19. Thank you very much.
Thank you, sir, for for giving the elaborative talk on this particular subject, and you make it so interested by your pictorial presentations. And I think there may be a lot of queries and questions. We have purposely kept such type of topics in this seminar because it has significance. Because now the lockdown situation. In some of the countries, there are post-lockdown situations have already started now, and there are a little bit of relaxations and office works, little bit have been started, some plants, little bit have been started. So I think our colleagues in different parts of the globe, they should know what precaution they have to adopt once they are going for a work in different area, whether in a plant, whether in an industry, or whether in their respective offices. So if I have to summarize your talk, I think the few points which you have highlighted, you are very clear that epidemics and pandemics of 21st century. That was your first slide to start with the talk, and then you talked about the stages of the disaster, then the various pandemic response stages where you talked about the prevention, preparedness, response during standby, response during action, response during response for targeted action, response for stand down, then recovery. And then you talked about the different countries' scenarios, how other countries have started working into this pandemic situation and how they have started recovering from the things. You have given the example of Africa. Africa is not a defensive-less victim. So, but on the other hand, why it is like that? Because already the Ebola or infection diseases they have already faced. So, so they are not going to be a defensive-less victim. New Zealand, you have given the example that they have adopted an elimination strategy, but that elimination strategy cannot work in all other countries because the population is very new. And if other countries, if you see, like you have given the example of South Korea, where they have in a position to control the virus. Why? Because they have adopted the strategy of treat, test, and trace. So these are the strategies which the South Korea people have adopted. So why it is important to treat COVID-19 in disaster-like situation, though it is a public health emergency, that particular thing also you have elaborated and we have highlighted, are we ready for that or not? And what COVID-19 has idea about disaster management. So we keep the public well informed. Big data and IT are important. Regarding the public information, Ministry of Health and Family Welfare and Ministry of Home Affairs, daily they are giving their briefings to the whole country at around 4 o'clock in the various channels, and they brief all of us and they keep us updated what is going on in our country. I think similarly other countries also into their channels must be doing there. So then you talked about the social development goals. What do they mean for disaster risk reduction? Then joint efforts to protect the city. Then the key pillars in responding to COVID-19 crisis. Then you talked about the integrated occupational safety health into government crisis responses. Then social dialogues on OSH in times of a pandemic. Then informal workers you have highlighted about, and you can see that in India is facing a huge crisis, but because of the informal workers, the laborer class have started moving from one places to the another, and daily we are seeing there are a lot of accidents are happening, spread of the cases are going on. Particular role of OSH practitioner, what role they can play in their respective industries for the workers, for the communities, then protecting workers from the risk of the contagion at the work, then emergency response workers. Then you have addressed, you have talked about addressing the stress and the psychosocial factors during pandemic, then people working from home, because now these days working from home strategy is much more going on because of the lockdowns all across the globe, and there are so many factors in the home situations while you work. You never get that type of environment while you are in an office, but there are certain precautions which you all of us have to adopt. Being continuous working, long hours, then whether you have the proper IT facilities or not, whether or in home also you have to adopt a lot of precautions so that working from home should be conducive enough. Some lockdowns have been relaxed and then people have started moving to the offices also. We have to be very careful about the preventive strategies in the offices also. Then people movement framework, transportation, then things to keep in mind while in office, things to keep in mind while in plant, and the precautions for self. And then we have talked about various forms and formats. I think this particular pandemic, COVID-19, has given us so many lessons, and it is going to be a game changer for all of us to learn from such type of lessons. With this, I will end from my side, and I will be really thankful to you for elaborating this thing. I think there are multiple questions. Over to you to hand over the questions, sir.
Thank you, sir. So I'll be taking the questions now. I have a question from Subbarayadu Challa. Please explain about importance of invisible fire due to hand sanitizers and styrene gas leak in Vishakhapatnam. So regarding the invisible fire due to hand sanitizer, we all know that sanitizers have around 70% alcohol in them. So these actually pose a risk. And when you actually sanitize your hands, and when you even sanitize the key of your car and put it inside the ignition thing, it sometimes actually sparks and catches fire. So we need to be careful regarding this. And when we have sanitized our hands, we cannot light a matchstick. Sometimes it may catch fire if we haven't dried our hands properly. And styrene gas leak in Vishakhapatnam. In Vishakhapatnam, this styrene gas leaked recently, so which resulted in numerous deaths, and over 5,000 people were affected because of this. Styrene gas is actually a known carcinogen. So what it does is, like any of these gases, they actually cause lung fibrosis. There will be exacerbation of COPD like symptoms, and when people are healthy, they are going to have fibrosis of the lung because of this gas. May I know the GP guideline during COVID-19? So for the general practitioners guidelines, I think in the next session we'll be having a total guidelines, or we have already done that. I think we have already touched upon that, Vijay Kumar. Explain the abbreviation OSH. OSH stands for Occupational Safety and Health. So in actually workplace, there are occupational health physicians, safety personnels, and industrial hygienists. So these three people are collectively known as occupational safety and health professionals. So please speak a little bit about epidemiology of COVID-19 in pregnancy. Question from Dr. Sunil Kumar Joshi. So what effects does coronavirus have on pregnant women? So when it comes to pregnant women, they say in pregnant women they have milder symptoms, mild symptoms of cold or flu-like symptoms, cough, fever, shortness of breath, and headache. What effect will coronavirus have on my baby if diagnosed with the infection? There is no conclusive study still, but I think when it comes to baby, sometimes the baby may be affected or may not be affected. I hope I answered this. What are the problems and challenges and response action and how to overcome to get lessons in future? Problems and challenges in response action and how to overcome to get lessons in future. By a question by Dr. Tensen. Dr. Tensen, I'll come back to your question later. What actions are necessary to overcome the resistance of regulations? The resistance of regulations, I guess like by this question, you mean to ask me by the resistance of the people due to the regulations what the government has put. We have no other way go. We need to follow them when it comes to guidelines from the government, because we have to collectively act over here to bring down and reduce the COVID-19 crisis. Disinfectant tunnels has been proved hazardous to health. So no doubt disinfectant tunnels were told like they are actually hazardous to health by the government and the health ministry. But the recent study, which has been done by NCL and ITC, that is the National Chemical Laboratory and Institute of Clinical or Chemical Technology in India, say that using 0.02% to 0.5% sodium hypochlorite is, so it is the safety depends on the dilution. So the dilution should be maintained between 200 to 500 ppm. So 0.02% is safe for normal office space and 0.05% is safe for frontline workers. Here the concentration plays an important role. Good afternoon, sir. How do you manage dead body of COVID-19 and mass casualty? When it comes to mass casualty, we need to actually pack the bodies in the covers, in the dead body covers, and we need to actually spray the dead bodies with 1% sodium hypochlorite. Hand washing with soap is for 20 seconds, or some guidelines says for 40 seconds. So which one is correct? 20 seconds is right, but there is no harm in washing hands for 40 seconds, which will even prove to be a better practice. Dr. Sajid, I hope I answered. First, thank you, Dr. Raghutam, for your nice presentation. Thank you. Please suggest this slide will share to all participants because, thank you, it will be shared. Thank you again. Clearly it's helpful and it is related to the reality which we are facing today and not easy to manage to different behaviors, mostly for non-health care population. Subbarayadu Challa. Thank you very much, sir, for excellent explanation both about hand sanitizers and styling. By which mechanism COVID-19 spreads from dead body if he or she is not coughing. Basically, in the dead bodies, the lungs will be lungs and the mucus layers will be containing the COVID-19. So we all know like this will definitely pose a risk because we need to maintain a social distance of 6 feet. And when we are handling the dead bodies, we'll be close to the body. And we can, that's how we can expect the spread of COVID-19. Dr. Sajid, I hope I answered. COVID-19 has some symptoms for white persons and black persons. So currently we are not aware of that, but I guess the symptoms do not really change drastically, but it does definitely vary from person to person depending on what comorbidities he has. Why white person were more have died more than black persons? Uh, Regarding this, I can say like when it comes to Italy and United States, maybe a bad strain of coronavirus has gone to that country, or maybe another reason being uh, proper guidelines were not followed initially, and people did not care much of this. And another cause is like, for the testing to happen, there was a lag period. So the testing kits had to arrive from China, and there may be like, false positive tests also when it comes to testing. So some positive cases might have been tested as negative, and these people might have roamed around and spread the infection. I really support the COVID-19 as a disaster worldwide, but the big problem will be to Africans who have different beliefs on this pandemic, and it will be a big challenge to handling this. So what can be the good strategies to use? The good strategies to use is like, as I told you, the proper usage of personal protective equipments, following the guidelines assured by your country, maintaining social distancing and sanitization, and avoiding contact with affected people. And when people are having symptoms, they need to go and get tested instead of hiding, and instead of going and spreading the information or the infection. So all these things need to be done. Thank you very much. So I'm done.
I think there's one last question, sir. I think.
Yes.
What are the problems and challenges in response action and how to overcome to get lessons in future?
Problems and challenges and response action and how to overcome to get lessons in future. So the challenges in this have been the shortage of kits, the shortage of personal protective equipments, and the shortage in the ventilators, the shortage in intensive care unit beds. So all these issues related to medical system should be upscaled by the government of the respective countries, and health should be given more weightage in the coming days, and we need to concentrate on these to actually bring down the problems. Weldonson, can somebody get prevent from pandemic when exposed to sun? There are no conclusive answers for this. The infection actually spreads through respiration and through respiratory droplets. So I cannot say anything regarding this exposure to sun. What mortality rate is less in female? See, currently, like when we actually look on this coronavirus cases, even in India, the number of cases which wherein they have affected females are less, and this may be because, like, in India, the females do not venture out of the home, and they are basically um, they avoid contact with the people and the general public. That may be one of the infection rate is less in female, and then so is mortality rate. We need completion certificate and CPD point. So you can ask the PHF Foundation.
Yeah, that will take care. I think sir, with this we have come to the end of today's session, and we are really thankful to you for taking a lead on this session, and we are really thankful to all the participants, those who have joined in today's session. So tomorrow we are going to have the last session of this series, which is again at the same timing at 3 o'clock, that mental health implications of COVID-19. So we would request all the participants to join this session at same 3 p.m. and look forward to have you all. With this, stay safe, stay home, and continue in this pandemic area as a frontline fighters, not as spectators. So all the best. Take care with this. See you tomorrow. Bye. Thank you, sir.
Thank you.